Since having COVID, have you lost the ability to smell? Or do things not smell right? In this video, I'm going to tell you what it is, what causes it, and what you can do that may help you regain your normal sense of smell. Hi, I'm Dr. Rick Kelly, a practicing physician with over 30 years of clinical experience. If you've gotten this far, you probably have at least heard of anosmia. But what is it? As with many medical conditions, there are often a confusing array of names that mean the same or slightly different aspects of a condition. In this case, anosmia, or the lack of a sense of smell, falls under the label of dysosmias, or abnormal sense of smell. As I said, we have anosmia, the complete lack of sense of smell, and hyposmia, a reduced sense of smell, and parosmia, an altered sense of smell, and then phantosmia, when you experience smells that are not really there. That's the one that got me. What is the cause of anosmia? Well, a normal sense of smell occurs when molecules travel into your nose and excite the olfactory nerves located in the upper part of your nasal passages. As with any of your senses, the nerves are stimulated by something, in this case an odor. The nerve then transmits the signal to the brain, which then interprets or categorizes it based on memories of things that you've smelled or other factors. In the case of dysosmias, something has happened to obstruct or damage the sensory tissue or the nerves that carry the signals to the brain. Some of the causes can be infections such as colds, flus, sinusitis, or COVID, as we'll discuss. Also head trauma, allergies, aging, radiation treatments to the head or neck, exposure to dangerous chemicals such as pesticides or solvents, maybe abuse of cocaine, smoking, or even neurodegenerative diseases like Parkinson's or Alzheimer's disease will result in anosmias. Researchers tell us that anosmia has been a symptom of almost 50% of patients who are ill with COVID-19, and that's consistent with what I see in my practice. Fortunately, most of these cases of anosmia will resolve or improve on their own within a few weeks of infection. But what if you don't get better and your sense of smell doesn't appear to be returning to normal after COVID? Well, first, it's always a good idea to see your primary care doctor and see if anything else might be going on and if he has any recommendations for your treatment. Unfortunately, as doctors, we don't have a magic pill or a magic nose spray or really any good treatments for anosmia, except to treat the underlying conditions in certain cases. That's where smell training comes in. This at-home treatment provides a low-cost and low-risk way to aid recovery. Think of it as physical therapy for your nose, except there's no pain involved. And the sooner you get started, the more benefit you should get. So here we go. You should do smell training first thing when you wake up in the morning, and then right before you go to bed. Essential oils in small glass bottles are usually used. The recommended oils are rose, lemon, clove, and eucalyptus. You can use more than that or do smell training more than twice a day if you want. Here's the technique. While seated at a table or on your bed, you take one of the scents. In this case, I've placed some of the purchased scents into a small glass bottle. You could use a blue or brown bottle, but I found some clear ones. You open it and bring it very near your nose. You don't want to take a deep inhalation or breath. Instead, you want to take small sniffs, just enough to move the scent up into your nose. Do this for 20 seconds while you imagine what the smell should be and whether or not you can smell anything. And second, if it is true to what you remember the scent should be. After you've done that for 20 seconds, breathe normally for 20 or 30 more seconds, and then do the next one. Breathe. You get the picture. Once you've done that, you want to store your bottles in a cool, dark area away from heat and light. A good idea is to make a logbook, and as you do each scent, record on a scale of 1 to 5 how strong each scent is and how true it is to what you remember. This will help you track your improvement over time. Smell training isn't a quick fix. You may find that you recover by 12 weeks, though some will continue for 24 weeks or more. Just stick with it. Remember, recovery from dysosmias can take a long time, and sadly, not everyone recovers. But smell training is something that you can do to take control of your condition. Post-COVID, I developed phantom smells or phantosmia. Thankfully, it is not an unpleasant smell, but frequently I smell a somewhat sweet odor, not unlike cologne, but something that I know isn't present. If you've had phantosmia, tell me what type of smell you detect in the comments below. Also, if you've had anosmia, please share your experience in the comments. For those looking for more information, I found a website in the UK that has excellent information for those who suffer from anosmia. It's absent.org. I'll put a link in the description below. Please subscribe, like, and click the bell and leave a comment to help me grow my channel. Thank you, and be well.